Hey, my name is Reese Miller. I'm a fourth-year med student here at IU School of Medicine. I'm going to give you a little presentation on airway fires, how to handle them so you don't end up panicking like SpongeBob down here. Some general fire tips: know where your fire extinguisher is in the OR, know how to use it, and also know where the gas shutoff valves are. It's very important to know how to handle these situations because, as you can see, if ignition of the gas occurs with the endotracheal tube, it almost creates like a rocket or firework-like effect, which can severely damage the trachea. And it occurs when you have this situation where you have the fire triad. So you have some kind of ignition source like a laser. You have some kind of oxidizer, typically the gases we use like oxygen or nitrous oxide. And then you have some kind of fuel like the endotracheal tube, drapes, gauze, things like that can catch fire. And it typically occurs whenever you have surgery near the larynx and the vocal cords where a laser or electrocautery tool will be close to an oxidizer and ignition can occur. And oftentimes it will occur if you don't properly inflate the cuff itself, because you can get leakage of air around the cuff if it's not properly inflated. And then you can get gas in the area where the surgery is actually occurring. And then you get ignition and the fire. Some things we can do with the endotracheal tube to kind of prevent this from occurring: you want to make sure the cuff is pretty deep to the vocal cords, but obviously above the carina, so you're not ventilating one lung. You also want to ensure the cuff is properly inflated to prevent the issue I talked about in this slide here. You also want to make sure that you inflate the cuff with methylene blue. Now, they recommend this because if there's any damage to the cuff from the laser, you'll have leakage of the methylene blue, and then they know immediately to stop the procedure right there. And you also want to use one of these laser resistant endotracheal tubes down here in the bottom right. There's several, and you can use any of them. Some things you can do inter-op: if there's ever sponges or gauze, you want to make sure that those are moist if they're near the ignition source. And you also want to avoid using nitrous oxide, and you also want to avoid an FiO2 greater than 0.3%, which can be a problem with patients that become hypoxic. Okay, and then management. So if this does occur, the first three steps are very critical to do as quickly as possible. First, you want to stop the procedure. You just want to stop everything and you want to handle the situation that's in front of you. You want to stop the flow of all the gases. You can either disconnect the circuit from the tube itself, or you can shut off the gas at the flow meters I'm circling right here. This will often decrease or even stop the fire itself. And you also want to remove the endotracheal tube. The endotracheal tube, even after the fire is out, can be very hot. So you want to make sure and get that out of there so that it's not causing additional damage. You also want to keep that endotracheal tube. You don't want to throw it away because you can analyze it, make sure that there aren't any fragments left in the trachea that you'll have to go in there and get yourself. Some other things after all that has occurred: you want to douse the airway with saline or sterile water if there's still a fire occurring after the previous three steps have been completed. I know it sounds counterintuitive, but it's something that can help put out the fire. And establish ventilation with an ambu bag or a circuit. You want to make sure and use room air if there's still a fire occurring. And then once the fire has been completely extinguished, you can use 100% oxygen. Now, you're going to want to use your endotracheal tube examination and bronchoscopy to assess the injury to the trachea and make sure that there aren't any fragments left behind that you're going to have to go in there and get. And then reintubation is going to be likely because you cause pretty significant damage to the trachea, and then you're going to have edema over time. So intubation is a very good thing to do. Here are my sources, and thank you, and here are my pups.